Welcome to the Business Growth Spotlight, where we shine the light and talk with business leaders from all over the world who are here sharing their expertise and wisdom so we can all grow together. I'm your host, Heidi Schalk, co-founder of Growth Solutions, and we help businesses grow their revenue using AI and visibility strategies. If you're new to the podcast and you're just joining us for the first time, welcome and thank you. We're glad to have you here. And I'm excited to introduce you to my guest today, Ryan Duncan with MedFlix Plus. So welcome, Ryan, to the podcast.
Thank you very much.
I am excited to dive in because we chatted last week and I learned more about what you do and your company, and I was very intrigued. So I'm excited to be learning more along with my audience, but also sharing your vision and your company. So Ryan, can you tell us a little bit about yourself? MedFlix
I'll
Plus.
just
Yeah,
definitely. I'll just kind of tell you how I got here. So I've been in the clothing business for 30 some odd years, and I went out on my own in 2014. COVID hit. I wasn't financially secure enough to get through it, and my insurance, which was fairly expensive, was one of the things that I lost, and I was having a hard time. I was bitching to my dad. A close family friend owns one of the largest employee benefits companies in the country in Dallas, Texas. So he calls Joel. Joel makes me a fake employee of some company. I get to use the benefits app for like 3-4 months, and I was kind of beside myself. I'm like, this is available, this is out here. I had no idea. And so having direct access to the owner, having the idea, I thought, what the heck, let's go, let's try it. So I went down and pitched my idea. He said, right, I don't see why not, go for it. So I get all my I's dotted and T's crossed contractually and all that. And I start trying to raise money conceptually, which I realized later was very difficult and wasn't working for me. So, well, at that point in time, the telemedicine industry came through and put parameters on how the product could be sold direct to consumer. So I thought I was toast, but having the idea early enough and early on and getting the contract, I basically got grandfather claused in, which will take away a lot of my chase competition in the future because they're not allowed to contract any longer, hopefully. But so then I realized, heck with it, I'm going to go for it. So I kind of bootstrapped it and did the whole Kevin Costner Field of Dreams. If you build it, they will come model. And that's kind of where I'm at now. Is the product is fully live and fully functional, has been tested and battle tested by corporate America. There's over 3 million people on the platform already. I'm just piggybacking and bringing it to people that never had access to it.
So Ryan, can you tell us a little bit about how the platform works and also the gap that you are filling?
Well, basically, so MedFlix, there's 3 different levels. There's MedFlix, MedFlix Plus, and MedFlix Pro. MedFlix basically is your basic plan. So for $19.95 a month, you, your spouse, your dependents up to age 26, up to 4 dependents, you have access through your app on the phone. You can utilize Teledoc as many times as you want, no charge. So you have Aetna Dental Access, which gives you the PPO pricing. The only difference is you have to pay for it at the time of service. You have Coast to Coast Vision, which give you a discount on anything from eye exams to LASIK surgery to anything optical. You've got a prescription drug discount platform, kind of like a Good RX on there, where you can check the price at any pharmacy, your discounted price at any pharmacy within a 50-mile radius. It's all just basically things that all benefits that large corporations would purchase for their workforce to wrap around the subpar insurance they provided them, so they wouldn't have to use the insurance as much. And it's an amazing product. And I just found a way to make it available to the general public, which is hopefully kind of where I'm at. I'm in the money raising process simply because I'm a student of perception and I am trying to launch it correctly. Plus, I'm tapped out, but it's been quite a journey so far, and I wouldn't change a thing. But it's definitely, I've had to relearn patience, which I wasn't aware I ever had, I guess. But it's been quite an adventure so far.
Yeah, well, this is very exciting. So MedFlix Plus integrates medical content, education, and connection. How do you see educational content supporting both your patients and healthcare professionals in today's rapidly evolving healthcare environment?
Education is always important. It's kind of like basically our marketing strategy is we have to educate the public that this is available, that this is out here. Through the app, also, we send push notifications that remind you to, hey, this is National Liver Awareness Month or whatever it is. So we try to educate people that are on our platform and give them gentle reminders and try to help them be vigilant with their health.
So many digital health platforms focus on convenience, and MedFlix Plus, emphasizes trusted medical knowledge. So, what challenges do patients face in finding reliable medical information?
Oh, well, the great thing is through the app, there's a service called Health Advocate Solutions, which basically will help you navigate the crazy healthcare world, and they'll even help you if you have to go to the hospital or have one of those 3-page bills that look like a letter that you get after you have something happen. They'll walk you through it and tell you what you can dispute and fight, and what you do have to pay. And then if on the other side there's a nurse hotline, you can just call a nurse and talk to them 24/7. Just ask a question. You don't want to go through the video chat or anything like that. There's a bunch of different aspects that help through that process because it is such a process, and it's most people will procrastinate and they won't be vigilant with their health because the process is so confusing and they don't trust it. And I think I think AI is going to help in that situation also with just re-educating and gaining people's trust. On my platform, we kind of came into the industry, and if you've seen the website, more as a disruptor. I mean, I tried to get I did do it. I got my daughter on some GLP-1s a couple of years ago, or a year and a half ago, and just the process of I'd had to click. I think I clicked 7 different times before I got to where I was at the point where I had to pay, and I didn't know what I was going to pay. It was just a frustrating experience, and I get an email. I have to do something else. So we tried to make it as transparent as possible and as easy to see. This is what you get. There's a video on each benefit on the website. It's a one click, you see the price, one other click, you fill out the information, then you get an email with your member number, and within 24 hours you're good to go.
Wow, I was going to ask you the timeline. So this can be used right away. There's no waiting.
It's basically the period it takes them to do the proper paperwork to get it through. Sometimes it takes 12 hours, sometimes it takes two, sometimes, but they up to 24 hours. So it's relatively quick. And once you do get on, you just kind of go through a little sign up process. You're going to add your dependents, you're going to do all this stuff, and then it's about a 5-minute process, and then you are good to go.
Yeah, and we when we talked prior to us actually recording, you had shared that you use this more than you use your insurance. So this is a great thing to have right alongside your insurance, because it's probably, I'm sure it's a lot in deductibles.
Definitely.
Yeah.
Well, you still need insurance. I mean,
Right.
for certain. I mean, someone that has needed it, I utilized it at MD Anderson. So yeah, you need insurance, but this just allows you to be more aware of your health, of your body, and just simply having direct access to, I'm a guy, and we don't go to the doctor until we feel like we're gonna croak, or we let it get bad before we go. And I didn't realize I would utilize it, but I think I used my teledoc feature 18 times last year. They give me a report at the end of the year and all that. And I never would have ever thought that I would have done that or take it or needed it like that. But it was only because I would put off and procrastinate until it got so bad. So it's allowed me to be much more vigilant with my health care. And I think again, that's part of the education process, is letting people know that, hey, this is out here. It's a tool to be utilized, and the more you utilize it, the better off you're going to be.
Yeah, like you said, many people are like you. They'll wait till it gets really bad in order because we're busy. We're busy people, right?
Right. Yeah.
To call, to make the appointment, to get in the car, drive there, sit down. And then some of these questions, maybe you might be nervous asking a doctor in a room where you can do this from the comfort of your home when or on your cell phone real
Yeah.
quick. And it's just a much simpler process and it's more efficient. You can get the
With
answers you need in a much quicker
with
fashion.
without a doubt. Yeah. I haven't used my insurance in over a year. It's just you need it, but it's one of those dirty words. You don't want to have to ever use it, but you
Yeah.
need it. So this allows you not to use it hardly at all, and
Yeah, and
only in situations where it's really needed.
and like you said, AI is readily available. So is Google, and we still do. I still do it. I'll still go to AI, or go to Doctor Google, and we'll put in our symptoms. And oh my gosh,
Oh,
get really nervous and scared, right? So now
or
we have a place to get answers quickly versus sitting there and freaking out for 2 weeks till we can go see our doctor.
yeah, no, it's we live in an amazing time and a crazy time for sure. But our
Yeah.
healthcare system is broken, and I don't see it getting fixed quickly and anytime soon. And this is just a nice little band-aid, a little help out. I mean, if you're a guy that has a lawn care service and you can't offer stuff to anybody, this is just a resource that can again make their lives better, and it's not going to cost them a whole lot. It's a resource that I found to be incredibly valuable.
Right.
And
Absolutely.
and again, that's exactly why I started the business. Was I didn't know why people didn't have access to this, and come to find out, with the app really made it more feasible, usable. I mean, back in the day, you get a card and you'd have to call numbers and all that. It's just the advent of the technology that makes the product that much better.
Mm. Yeah. Well, let's talk about your business and growth. Let's go there. How are you getting out there? How are the podcasts? Obviously, you're on this
So
podcast. What are the things
so
that you're doing?
I hired uh, I hired a gentleman who started a company fairly freshly new that is doing all my LinkedIn stuff. And he's just doing such a great job. I don't have the bandwidth for it with everything going on. I can barely keep my head above water. So that is really, I mean, I've struggled through trying all kinds of stuff locally, and you just kind of never doing anything like this. It's a learning process, and I have been learning and trying to learn as much as I can as I go. But I've found that I got to a point where I didn't know who to ask. And so this is where the LinkedIn came in, and where I've got newfound faith in humanity, because I've talked to so many amazing people, and most everyone has been incredibly supportive and nice and helpful and generous with their time. I mean, it's been really cool.
Yeah.
And so now I'm working with a group out of Austin, Deanna Brown and Jeffrey, and they are streamlining the deck where it's looking. I mean, because my deck prior, and they pointed it out to me, it looks like a deck, or it's good, but it was more focused on selling the product, not how the product gets out there. And so they're revamping things, and they're gonna get me some warm leads in front of have found by going through this that being pre-revenue, VCs aren't going to touch you. I mean, you have to, and for a startup group, you have to jump through so many hoops to fit in their little tiny box. And so we're focusing on more angel investors and family offices and stuff like that. So, and the traction from the LinkedIn thing is really what started all of this and got me in front of you. And it's been an incredible tool.
So
Uh,
is your person doing content or is he doing outreach or a combination of both?
he's doing outreach, and then basically he'll send the deck, and then the conversation after that point we'll do a zoomed in call. And I just he sends me my appointments for the morning, and I read up and just kind of go through my motions and get ready to talk to some great people, which is, and
Amazing.
I mean,
Yeah.
I've talked to people in Australia, I mean, UK all over, India. I mean, it's been really fun.
Yeah, it's all about relationships, right? At the end of the day.
Yeah, yeah,
So yeah, so partnerships. Do partnerships play a role in scaling Medflix Plus?
definitely. So we're kind of coming at it as a excuse me, to B to C market. So it's kind of a funnel. So we're going to focus on small businesses, the gig worker market. People are seasonal workers. They have the option, but it's so expensive. No, they don't take it. They have nothing. Restaurant Association, Home Builders Association. I made sure the app is in English and Spanish. Different associations that we're going to look to partner with to basically get the name out. And then, we have the ability to then, turn around and share part of the proceeds and kind of give kickbacks. And I'm not sure the exact term that's legal to say about that, but that. And then we're looking into doing some more specialized, have a collegiate Medflix that's focused really on college kids and have it an option on their enrollment package or their bursar account thing. And again, so there's a bunch of different avenues to get it out there. It's just to trying to tell the story correctly, and I think we're on the right path.
Yeah, sounds like it for sure.
Yeah. So
So if I could give you a magic wand, Ryan, and you can wave it over one challenge you're having right now, what would that be that you could go poof and it would disappear? What would it be and why?
honestly, I'd say just getting the funding, but I think the looking at it after you pose that question, I don't. I think the process is really very rewarding, and I don't think I would use a magic wand unless I could just say, "Hey, let me get that first investor," because
Yeah.
it's kind of where we're getting to, and I think we're right there. But yeah, I don't know. I don't know if I would use that magic wand. I'd like to
No,
have
no
it in my
worries.
pocket though.
Absolutely. Just pull it
But
out when you want it, right?
it's
When you want to use
well,
it.
but and I have enjoyed learning through the process, so that's probably part of it too.
Yeah, absolutely.
I don't feel near as ignorant as I did before.
So what's the big plans for the next year? What are your big goals for Medflix Plus?
So I'd like to have a proper launch in the next 3 months, hopefully. Of course, we'd love to have members flowing in the pipeline, all that. I think by the end of the year, if I had 5,000 members, I would call that a success. I do have it contracted already and working to set up after we launch or somewhere close, we're going to launch a Medflix members only site, which basically, if you're already a member, you have the basic plan. You can go through and look on the marketplace and cherry pick different benefits to add to your base plan. So it's pretty cool. There's a bunch of different things out there that people just had no idea. That's part of the plan. Of course, 26 all going correctly, but 27 hopefully launch more regionally and probably have larger partnerships and stuff like that.
Fantastic. So, Ryan, can you tell us how people can connect with you and learn more about Medflix Plus?
Well, you can go to www.medflixplus.com and you can learn all about the product there. And there's a little about section where I did a video that'll basically tells the story and all that. Reach out to me on LinkedIn. You'll have to pop that down there because I don't even know what that is.
We'll definitely have it in the show notes.
Yeah. Or my email, rd@medflixplus.com.
Easy peasy. So RD, Ryan Duncan, RD
Yeah.
at medflixplus.com. We'll have all of Ryan's information in the show notes, and you can go to medflixplus.com to learn more about it. That's MEDFLIXPLUS. And there's three different options for,
Yes.
for
So
what you
yeah,
want to do. So can
I
you walk
didn't
us
even.
through those three options, Ryan?
So Medflix is the one I spoke about earlier, which basically is your base package that has the Teledoc Unlimited for the entire family, the Aetna Dental, Coast to Coast Vision, prescription drug platform. Then in the middle package, you've got more your mental health. So each member has up to 50-minute sessions with a counselor with over 5 years experience, and obviously all the degrees included in the plan for each member each year. So then you also have the health advocate solutions, which I was talking about earlier. The big package is MedFlix Pro, and that's where we kind of take care of all our furry family friends, which I know that you're fond of. And it's got, the pet care, which you get a 25% discount at participating vets. But the main deal is GoLexi has a telemedicine for pets, which is a televet basically, where, I know I've had this issue, but your dog starts making weird noises at 2 a.m. and you don't know what's going on, and you just freak out and you go take it to the emergency vet and you pay $150 for charcoal. So this just gives you an option that he's doing something crazy or she's doing something crazy. Hit a button on your phone, within 20 minutes you got a video call with a vet telling you, hey, you do need to take him, or no, just do this. I mean, they can't prescribe medicine to the dog over the phone or anything, but it gives you peace of mind, like I'm doing the right thing. It's double checking. It's just an extra resource also. So, and they're family members. I mean, we'll do anything for our pets. It's crazy. So this is just another asset. So
absolutely. I've had to call twice. Those dogs have passed so far, and we have, like I shared with you today, we're fostering one as of yesterday, and now we have one that we adopted. He's 13, but I had twice with two of my previous dogs that I had a call for, not knowing if they would have a reaction to something. So one of my little dog got one of my other dog's medications once, and I was freaking out. And you have to pay a lot of money just to even speak to someone. And then they tell you need to go to the vet anyway. And, so, and you don't know what to do. And you're like, do I go? Do I not go? And it's expensive. You're protected. It's available. Like you said, you have a database of information, and each of these programs or options or levels includes the other levels below it.
Definitely.
So like MedFlix is the basic, which is a lot. You get the teledoc, no visit fee, which is amazing. You get the dental access, the pharmacy, the lab testing, and vision. That's huge in itself for $19.95 a month. Like that's crazy.
The teledoc option there alone is worth that. Everything else is icing.
Yeah, absolutely. And then MedFlix Plus includes all of that, plus your health advocate solutions, your counseling services, and MRI and CT scans.
Yeah, I got to utilize that last year for my daughter, and I think I saved $340 from what anyone else would have paid. Yeah, it's just, again, it's crazy.
Yeah. The MedFlix Pro includes both MedFlix and MedFlix Plus. Plus, you get your telehealth, pet care, what's NB travel and NB deals.
So there's so many people on this employee benefits network already that are utilizing it, that they get different options so that's a large group. So they have their own kind of site where you get travel discounts on anything from airfare to hotels. I think they do a deal where they can sell Disney tickets cheaper or something like that. So it's just a little extra added something.
That's awesome. And you would think these are expensive, and they're not. I think it ranges from $19.95 a month all the way up to $29.95. That's it.
Yeah, that's it.
That's it. And $19.95, $24.95, and $29.95. And I paid $85 each time I had to make a call for the what would they call that? They call that like the poison control. And then both times I had to go to my doctor anyway.
Yeah.
So no, this is fantastic. And if you go to like PetSmart just for your pet, it could go up to $100 and something a month for insurance, depending on their age and what they include. And this is phenomenal. And this includes $29.95. You get both of the levels below it.
Yeah.
Like it's a no-brainer.
I'm hoping to get it out there. I've been very, very, very pleased. So
yeah. Well, I appreciate your time. For those of you watching us on YouTube, thank you. Ryan and I appreciate you. If you're listening to us on your favorite podcast platform, thank you for being here and for listening. Please share this out with everybody that you know, because everybody could use this. There's many times I'll say, if you know of somebody that would resonate with what my guest is sharing, but this is something everybody could use. I can't think of one person that this wouldn't be beneficial for.
Yeah.
So especially, I mean, if you have animals, I know how expensive insurance is for them, and you really can't be without it with the cost of surgeries, and you never know when something's going to happen. For $29.95 a month, you get this and get for you and your pet. It's just amazing. So please share this with as many people as you can. Let's help Ryan get the word out. I think it's a huge number of businesses that fail within the first 5 years. The goal of this podcast was to flip that number. And my guests, including Ryan, are here sharing what their expertise and what they've gone through, their challenges, what's worked for them, what hasn't worked for them, so that they're to be to support my mission of helping more businesses thrive. We want to see more businesses staying open, not more doors closing. So the way that we can do that, and we ask you to be on board with this mission and supportive, is to share Ryan and MedFlix Plus out to anyone that you know. So if you know of anybody that could be interested, or you know they could use this, please share it. Again, we need help in flipping those numbers and those percentages. And this is such an amazing, incredible product. I'm so excited about it. Any of your support would be we'd be grateful. If you're listening on your favorite podcast platform and you can leave a review, we'd love it, preferably 5 stars. That helps, that notifies the platform to push this episode out to more people, which is what we need. So we'd appreciate your help there and support as well. For those of you who are growing a business and you feel like maybe you're trying different things, Ryan shared it. You know, when you're starting up, you're just kind of trying new things, different things, and learning as you go. Go ahead and download our Spotlight to Scale blueprint. You can go to spotlighttoscale.com/blueprint. You can grab that. It'll give you maybe some ideas and thoughts for marketing and visibility that you may not have thought of. Ryan, before I let you go, we wrap up. Is there anything that you'd like to share or say that we didn't get to touch on today?
Oh, not necessarily. I just want to say thank you for your time and the experience. Everything's been wonderful. And hopefully this will help everyone, live smarter.
Yeah, absolutely. And save money in the process, right? Yeah. Live longer, healthier, and save money along the way. So thank you, Ryan, for being here. Thank you all for listening. Go to medflixplus.com. Go check it out for yourself. Don't take my word for it. Go check it out yourself. Go connect with Ryan. And I look forward to seeing you all on the next episode of the Business Growth Spotlight.